Well, New York is making progress towards ensuring that every individual receives quality health care. If we look at the state snapshot for the Agency for Healthcare Research and Quality, we can see that back in 2012, we were in the weak range, and then in 2013, we moved to the stronger range. I mean, we're average when we compare ourselves to other states. However, we've made some progress. More progress has to be made. When we think about healthcare disparities, we know, especially in New York, that they still exist. For example, why is it that if you and I both were the same age and we went into the hospital with chest pain, I probably would be treated less aggressively than you and my outcomes would be less than favorable? We need to advance how we're caring for people so that no matter who you are, regardless of your race, ethnicity, socioeconomic status, sexual orientation, your gender, regardless of anything, that you will receive the best quality care possible.
One thing that I find interesting that's important is the expansion of the Medicaid coverage to low-income adults, communities of color, people who are living with HIV. And the second thing that I find is also making sure that the Ryan White Care Act is being authorized to make sure to serve as a safety net for people living with HIV, to make sure they have the access to health care that they need.
One of the things that I love about living in New York City is that it is a melting pot. There are over 800 languages and dialects spoken in New York City, and probably close to 40% of the population are immigrants or descendants of immigrants. And in order to be able to provide health care, develop policy and the types of research that's responsive to the needs of this vast melting pot, we need people who look like the people that we're caring for.
The literature is robust in detailing the many barriers that nursing students face as they go through a nursing program, and it is also very robust in detailing the issues that faculty face as they're going through the tenure and promotion process. Students feel that there's a lack of faculty that is like them, looking at them and seeing this person has achieved this goal, I can do this. We really don't have enough role models in this area to support these students to want to move forward.
It's a critical time. It's an important time for us in healthcare because we have been challenged and we have been called to action. We have the Institute of Medicine report, Future of Nursing, that has called all nurses, all nursing associations to work together to develop mentorship programs. We have been called to action by the Affordable Care Act that has challenged the entire healthcare industry to work on achieving the triple aim, which includes increased access to care for all individuals and to be able to improve the patient experience and do all of that by reducing costs.
What's clear is that we need each one of us, as you've said many times, to add our voice and wisdom to change the status, to meet the healthcare needs of all people, regardless of race, religion, creed, ethnicity, gender, sexual orientation, or any aspect of how they identify in the 21st century, and we are here to meet that challenge.